and with runners of all ages,
Yeah.
they're working on following a healthy lifestyle.
Yeah.
They're also exercising, but mental health does come into play perhaps with their performance. And how do you treat that?
Sure. So for runners or people who are physically active, we find that in terms of their symptoms, they're probably at a reduced level, more because the exercise is actually helping them in terms of coping, and their management strategies are a lot better. But I think the most important thing is that if an athlete feels that there's something that's not quite right, or they're just experiencing symptoms that are just not normal or very persistent, it's definitely a good option to look into it further and seek medical help.
Right, because it could be like burnout.
It could, absolutely.
And then you're trying to perform well, but it's not working.
Right, and running harder and faster may not necessarily be the answer.
So you need to look back and assess it, and by going to you. And you said earlier, like an assessment, like you'll be like a 15-minute intake. Like, how does it work?
Yeah, so when a patient comes to see a naturopathic doctor, the intake is usually 1 hour, and it gives us the time that we need to do a very thorough intake, because we want to know not only their symptoms that they're experiencing, but all aspects of their health. Right? What are they eating? How are they sleeping? What levels of stress do they have? We also look at past medical history, their social history, and all of that information allows us to put the big picture together to understand what's going on.